Something is stuck in your skin. The next move can prevent pain, infection, and a much bigger problem. In the next few minutes, you'll learn how to remove ticks, stingers, and tiny skin fragments safely. Quick surprise, a tick is not an insect. It's an arachnid, more closely related to spiders. Different pests need different removal methods. One wrong trick can make a small bite much worse. Stay to the end for a fast checklist you can actually remember when panic kicks in. First case, a tick attached after a walk, hike, garden job, or even backyard cleanup. Ticks anchor themselves with mouthparts. Squeezing the body can increase the mess and the risk. The best tool is clean, fine-tipped tweezers. Not your fingers, not oil, not a match. Grip the tick as close to the skin as possible. That part matters more than most people realize. Pull straight up with steady pressure. No twisting, no jerking, no dramatic wrestling match.
If tiny mouthparts stay behind, don't dig aggressively. Small pieces often work their way out naturally. After removal, wash the bite area and your hands with soap and water or alcohol. Local advice differs, but saving the tick in a sealed container can help with later identification. Write down the date and where it happened. That tiny note can become very useful later. Over the next days or weeks, watch for fever, unusual fatigue, or a spreading rash. Common myth check. Don't smother a tick with petroleum jelly, nail polish, or random home remedies. Heat is out too. Burning a tick can stress it and make the situation worse. Quick recap. Tweezers, close grip, straight pull, clean the spot, then keep watch. Next case, a bee sting. Here, speed matters more than looking perfectly graceful. Honeybees leave a stinger behind. Wasps usually do not. That detail changes what you're looking for. If you see a stinger, remove it quickly. A scraping motion works well when it's easy to do. Use a card edge, a fingernail, or tweezers if that's what you have ready. The main goal is speed. Get it out fast and avoid squeezing if you can. After removal, wash the area, then use a cold pack to calm pain and swelling. Some itching is normal. Trouble breathing, throat swelling, or spreading hives is not normal at all. Comment check. Were you taught toothpaste, baking soda, or some other legendary kitchen remedy? Third case, a small fragment in the skin, like an insect part or splinter-like piece. Start by washing your hands and the area. Clean beats brave every single time. If the fragment sticks out, use clean tweezers and pull gently in the same direction. Good lighting helps more than force. Tiny objects become easier when you can actually see them. Don't dig deep. Digging turns a tiny problem into a painful, irritated, infected one. If it's in the eye, deep in the skin, or near the face, let a clinician handle it. Unexpected fact, the bug in your skin may actually be a thorn, wood splinter, or fiberglass sliver. Now for the red flags. This section matters more than any clever removal trick. Get emergency help for trouble breathing, throat swelling, fainting, or widespread hives. Seek medical care for spreading redness, pus, fever, or pain that keeps getting worse. After a tick bite, see a doctor if you develop a spreading rash or flu-like symptoms. If you can't remove it fully, stop there. More picking usually causes more damage. People with severe allergies, weak immunity, or blood thinners should be extra cautious. Tiny bite, big lesson. Smart first aid includes knowing when home care is no longer enough. Let's build a simple removal kit in under 10 seconds. Pack fine-tip tweezers, alcohol wipes, a small card, bandages, and a sealable bag. Add an antihistamine only if your doctor says it's appropriate for you. After outdoor time, check ankles, knees, waist, scalp, and other warm hiding spots. For kids and pets, calm check-ins work better than rushed panic and missed spots. Wear long sleeves, use repellent, and shower after risky outdoor time when possible. Prevention feels boring until it saves your weekend, your trip, or your sleep. Lightning quiz. Twist a tick out? No. Straight pull wins. Smother a tick with petroleum jelly? No again. Skip the sticky folklore. Scrape or squeeze a bee stinger? Scrape if you can, but fast removal matters most. Dig for a deep fragment at home? Bad idea. That's when medical help becomes the better move. Wash after removal? always. Cleanup is part of the treatment, not an optional extra. Here's the easy memory trick. Pull, clean, cool, watch. Pull for ticks and visible fragments using the right tool and the right direction. Clean the area after removal. Simple steps prevent a lot of avoidable trouble. Cool a sting with a cold pack when swelling and pain start to build. Watch for infection, allergy signs, or symptoms that appear after a tick bite. If this helped, save it now. The next bite never waits for a convenient moment. Drop a comment with the weirdest bite removal myth you've ever heard or been told. Like, subscribe, and share for more practical wildlife and first aid explainers from Nature Archive Docs.